Bismillahirrahmanirrahim. We are studying general anatomy. The topics we are going to cover are the terms used for describing the positions, the different positions of the body, and the terms used for the movements. The position describes the orientation of a body or body parts. The anatomical positions are important because they give us a frame of reference for describing the body. Similar to a compass, they give us a universal way to describe the position of an organism. There are four main anatomical positions, which is spine position, the prone position, the right lateral recumbent, and the left lateral recumbent. Each position is used in different medical circumstances. First of all, the spine position. It is a horizontal position with the face oriented up, or lying down position with the face directed upwards. The prone position is also a horizontal position. It is the lying down position with the face directed downwards. The right lateral recumbent position is the horizontal position with the right side oriented downward. Means that the patient is lying on their right side. The left lateral recumbent position is a horizontal position with the left side oriented downward, means that the patient is lying on their left side. There is a Fowler's position. A person in the Fowler's position is sitting straight up or leaning slightly back. Their legs may either be straight or bent. The lithotomy position is a common position for surgical procedures and medical examinations involving the pelvis and lower abdomen, as well as a common position for childbirth. The lithotomy position is lying spine horizontally with the buttocks at the edge of the table, the hips and knee fully flexed, and feet strapped in position. It enables dissection of the flap with the surgeon in a sitting position and improves the ergonomics of the procedure. Now we will discuss the terms of the body movements. There are three main divisions of the body movements: the gliding movement, the angular movements, and the special movements. All the movements that take place at joints may occur in any plane but are usually described in the sagittal and the coronal plane. The gliding movement is the simplest movement that can occur at any joint. In this movement, there are the two surfaces of the joints. They are relatively flat surfaces. They move back and forth and from side to side with respect to one another. But the angle between the articulating surfaces, the bones, they does not change. As we said that there are the two flat surfaces. They only move back and forth or side to side. There is no change in the angle. So this is the simplest form of the movement. Second one is the angular movement. In this type of movement, there is a change in angle between the adjacent surfaces, adjacent bones that are involved in that movement. The change of angle means whether the angle may decrease or increase. As the name we can see, the angular movement means the angle portion is involved. The angle is either increased or decreased. For example, in flexion. During flexion, this movement often occurs at the transverse axis, and it results in approximation of two morphological ventral surfaces. Approximation means the angle between the surfaces, it is going to be decreased. So the angle, as it is example of angular movement. So the angle is involved. The angle in the two adjacent bones is going to be decrease. So there is approximation of the proximal surfaces. Flexion has also been defined as the posture of the fetus in the uterus. The second example is extension. This movement also occurs at the transverse axis, and it results in the movement of two morphological ventral surfaces away from each other. As they move away from each other, so the angle between the two adjacent bone, it is going to be increased. So the angle increases. The two terms abduction and adduction, they occur at the anteroposterior axis. These are the two terms that are used to describe the movements towards or away from the midline of the body. The abduction is the movement of any part of the body that is away from the median plane, and adduction is the movement of any part of the body that is towards the median plane. These two terms are opposite to each other. So they are used to describe the movements towards or away from the midline of the body. The circumduction, it is a derived movement of the body in which the elements of flexion, abduction, extension and adduction are compounded. Circumduction is the circular movement of a limb. The meaning of circumduction is movement of a limb or extremity so that the distal end describes a circle while the proximal end remains fixed. So it occurs in the shoulder, hip and first carpometacarpal joints. The rotation. The rotational movement is the circular movement of the bone as it rotates around its longitudinal axis. The rotation can be towards the midline of the body, which is called as medial rotation, or it can be away from the midline of the body, which is referred to as lateral rotation. So the medial rotation is circular movement of bone towards the midline, and lateral rotation is the circular movement of the bone away from the midline. Now the special movements, as we have already discussed the gliding movements, the angular movements. Now the third type of the movements are the special movements. Why we call it special movements? Because these movements are found only on specific joints. They do not occur at all the joints of the body. They are only allocated to the specific joints of the body. That's why they are called as special movements. So the first are the inversion, eversion. As we already told that they occur at the specific joint. So these movements occur at the subtalar joint. The inversion is the inward movement of the sole of the foot, and eversion is the outward movement of the sole of the foot. They occur at the subtalar joint. The pronation and supination movements. The movement of forearm in which the palm is turned anteriorly or forward, it is called as pronation. The movement of forearm palm turned posteriorly is pronation. By posterior is the pronation. And the supination is the movement of the forearm in which the palm of the hand, it is turned anteriorly. So anteriorly is the supination. These two movements occur at the radioulnar joint. The protraction and the retraction, this movement occur at the temporomandibular joint. The protraction is the movement of the mandible, clavicle or scapula forwards on a plane parallel to the ground. That is the forward protrusion. The retraction is the movement of the protracted part backward, or the movement of the mandible backward on a plane parallel to the ground. The movement reverse to the protraction. So this movement occur at the temporomandibular joint. We have discussed the terms of body movements, the gliding movements, the angular movements, and the special movement. This is all about the terms of movements. Thank you for watching. Allah Hafiz.